Canada. For so many people, it really is the dream destination.
Absolutely. Politeness, nature, that famous healthcare system.
Yeah, place to start fresh.
Yeah.
But imagine getting so close to that dream and then, well, hitting a wall.
And that wall turns out to be your health.
Exactly. Welcome to the Deep Dive. Today, we're wading into something really critical if Canada's on your radar. The health rules that could impact whether you can actually get in.
We're talking about the specific medical reasons someone might be turned away, right? Whether for a visit, study, or moving there permanently.
That's the core of it. We're looking at an article today from CanadianVisa.org called 3 Medical Reasons You May Be Denied Entry to Canada.
A pretty direct title.
It is.
Yeah.
And our mission here is to really unpack this source. We want to understand those specific health hurdles, why these rules exist according to the article, and what happens if you run into them.
So getting straight to the core insights for you, the listener.
Precisely. Cutting through the noise.
Okay, so to really get these rules, you first have to understand Canada's healthcare system, Medicare.
Right, that bedrock. Publicly funded, covering nearly 40 million people. It's huge.
It is. And the article connects these medical admissibility rules directly back to protecting that system.
How so?
Well, there are 2 main drivers mentioned. First, protecting public health and safety, the health of people already living in Canada.
Makes sense.
And second, and this is key, maintaining the sustainability of Medicare itself, preventing what the source calls excessive strain on it.
Excessive strain. That term really captures it, doesn't it? Protecting the system's resources.
Exactly. And these rules, they apply broadly.
So it's not just if you're planning to immigrate permanently.
No, the source is clear. Medical inadmissibility can come up for anyone applying to study, visit, or live in Canada permanently.
Okay. And the decision hinges on?
The Canadian Immigration Medical Exam. That's the central piece, where they gather the health information needed.
Got it. So let's dig into those specifics the article highlights. It mentions 3 main reasons, 3 pillars of inadmissibility. What's pillar number 1?
The first one is being considered a danger to public health.
Okay, what does that mean in practice?
It means the immigration authorities, IRCC, look at your medical exam results, lab tests, reports from their approved doctors, and decide if your condition could realistically endanger public health in Canada.
So we're talking about infectious diseases mainly.
Primarily, yes.
Correct.
They're looking at conditions that could spread. The article mentions they consider if you have an infectious disease or even if you've just had recent close contact with one.
Right, protecting the wider community. Does the source give examples?
It does. The main text points specifically to tuberculosis and syphilis.
Okay.
And then the FAQ section in the article lists others too, like Chagas disease, avian influenza, botulism, brucellosis, even some rare diseases and tick-borne diseases could fall into this.
Wow, okay. That definitely clarifies the public health angle. What's the second pillar then?
The second one is danger to public safety.
How is that different from public health?
Well, this isn't so much about spreading disease. It's more about health conditions that might cause sudden problems, like sudden incapacitation, losing physical or mental control unexpectedly, or conditions linked to potentially violent or unpredictable behavior, things that could put people nearby at immediate risk because of a health issue.
I see. Any examples mentioned for this one?
Yeah, the article's FAQ brings up drug abuse and certain types of mental illness as conditions that could lead to failing the medical exam under this public safety category if they pose that kind of potential danger.
Okay, so public health is about community spread. Public safety is about immediate risk from incapacitation or behavior. Got it. Which brings us to the third reason, the one tied back to that excessive strain idea.
Exactly. The third pillar is excessive demand on health or social services.
Right.
This kicks in if the services needed to treat or manage your health condition are seen as too significant. Either they could negatively affect wait times for Canadians needing those same services, or the estimated cost of your care goes over a specific amount. There's a financial threshold.
And the article actually names that threshold, doesn't it?
It does. The source states the current excessive demand cost threshold is 171,736.75 CAD.
Wow.
Yeah. It's a benchmark they use to help figure out if the likely cost of your care would place, excessive demand on the system.
That number really brings the financial sustainability aspect into sharp focus. But is that it? If your condition costs are projected above that, is it an automatic no? Are there exceptions?
Good question. Yes, the article explicitly lists exceptions specifically for this excessive demand rule. Certain groups are exempt, regardless of potential costs.
Who are they?
Refugees and their dependents, legally protected persons, and importantly, people being sponsored by family already in Canada. So dependent kids, common law partners, spouses.
Okay, that's important context for those groups. But what if you're not in one of those categories and your condition is flagged for excessive demand? Is there anything you can do?
Well, the article mentions something called a mitigation plan, but it's not something everyone can just choose to do.
How does it work?
It's something IRCC might ask you for in certain cases.
Yeah.
If they do, it's basically your chance to show them how you plan to cover your healthcare costs without excessively burdening the public system.
So you have to make a case for yourself.
Exactly. And the source stresses needs to be credible, detailed, specific to your situation. You'd have to explain how services will be provided, how you'll pay, and provide proof you have the funds for the needed period, financial documents and all that.
Okay, sounds quite involved.
It is. And there's a really crucial point the article makes. Generally, you can't just use this plan to say, I'll pay for the public services myself, to get around the excessive demand finding.
So you can't just opt out of Medicare costs with this plan.
Not usually. You can't just offer to cover what the public system would normally pay for residents. The source mentions a possible exception might be for some outpatient prescription drugs in certain areas, but that seems limited.
That's a key distinction. It's not about buying access to public services.
Right. It's more about showing you have arrangements outside of that potential public burden where possible and allowed. And if they ask for this plan, you also need to sign a formal declaration of ability and willingness form.
Basically promising you'll follow through.
Pretty much. Agreeing to arrange and pay for the services outlined in your plan.
Okay, so there's the exam, the criteria, these potential exceptions, maybe a mitigation plan. But what if, after everything, you do get flagged as medically inadmissible? Is that the final word?
Not straight away, no. The article explains a key step. Before any final refusal, you get what's called a procedural fairness letter.
Procedural fairness. Sounds like a chance to respond.
Exactly that. The letter tells you why they think you're inadmissible, based on their assessment. And critically, it gives you an opportunity to submit more information or evidence to address those specific concerns.
Okay, that's important. How long do you get?
Typically 90 days, according to the source. And it mentions you can ask IRCC for an extension if you genuinely need more time to get your documents together.
90 days. And what kind of stuff can you send back?
Things like updated medical reports about your condition or diagnosis, maybe more precise info on the actual costs of the medication or services you need, specifics about the types of services required, anything that might clarify the situation or challenge the initial assessment.
And you can get help with this response.
Yes. The article notes you can seek advice or get representation, like from a lawyer or consultant, though it's optional.
Right. That 90-day window seems crucial. So pulling back a bit, how can someone best prepare for all this? How can they proactively try to ensure they meet the medical admissibility requirements?
The source lays out a few practical steps. First, and maybe most obvious, is just do your homework. Understand IRCC's medical inadmissibility criteria before you even apply. Know the rules of the game.
Makes sense. What else?
Second, make sure you get that required medical exam done by an approved panel physician and ideally pass it. That exam is foundational.
Right.
Third, get your official medical report or certificate from that exam.
Okay.
Fourth, if the exam does flag any potential issues, be ready to address them. That could mean providing extra documents, showing treatment plans, or, like we discussed, preparing a mitigation plan if IRCC asks for one.
Be proactive about any potential red flags.
Exactly. And there's one more really critical point the source makes, especially for permanent residence applicants. It might catch some people by surprise.
Oh, what's that?
You have to include all your dependents in the medical exam process, even dependents who are not coming to Canada with you.
Wait, really? Even family members staying behind?
Yes. The article is quite clear that the medical admissibility of your non-accompanying dependents can directly impact your own admissibility for permanent residence. Their health status matters for your application.
Wow. That's a huge detail. It really shows how comprehensive this assessment is.
It certainly does. No stone unturned, so to speak.
Okay, so let's wrap up this deep dive. We've looked at this CanadianVisa.org article and unpacked those three main health reasons for potential inadmissibility: danger to public health, danger to public safety, and that big one, excessive demand on health or social services.
And the central role of that mandatory medical exam.
Absolutely. Knowing these criteria isn't just, ticking boxes. It's vital information if Canada is on your horizon. Whether for a short trip, studies, or a permanent move, it's really about being prepared and understanding the system's parameters.
And the source really highlights that fundamental tension, doesn't it? For a country like Canada, balancing the desire to welcome newcomers with the need to protect the viability of a cherished public system like Medicare.
It really does. It leaves you thinking, doesn't it? Consider this. When a country with universal healthcare like Canada sets up these kinds of health rules for immigrants, how do they actually go about measuring and predicting future health needs, especially across such a diverse global pool of applicants?
The practicalities must be immense.
Right. What does that process even look like behind the scenes, trying to apply these specific criteria, like that exact dollar threshold for excessive demand, consistently and fairly, day in, day out, on such a massive scale? What strikes you most about the sheer administrative challenge of running a system like this?